Okay, number 10 here, exercise number 10 is a seated cervical or first rib adjustment where the patient is obviously sitting nice and straight here. I really don't use this one very much, but it's definitely something that's worth practicing with the Dynadjust because remember, we're training specific muscle groups to do high velocity, low amplitude manipulation and any combination of doctor-patient positioning. So here, if I was going to do this adjustment, I would probably rotate Maria's head away from the side of the manipulation. I'm using the thenar eminence in my thumb along the base of the occiput here to stabilize the other side. And if I was going to do this adjustment, I'd have her rock her head a little bit back here. I'm holding the weight of that head in my hand. This way she's not holding her head up. And I would palpate along the SPs here in the back with my thumb, of course. Find that segment that I'm looking to induce a little rotation in and thrust pretty much in a plane just about like this. Now, of course, that can be done on either side. In this case here, we'll have her head back just a little bit here in the same thing. And for some reason, even though my left hand is my non-dominant hand, when I do this adjustment, it actually feels more comfortable for me. And I'm not sure whether that's a function of the fact that maybe I do another adjustment in my practice where this angle has been, more highly developed. The muscle groups involved in making this thrust, for some reason this feels better, even though this is my non-dominant hand. And of course, if you wanted to effect a first rib adjustment here, basically the same thing, a little less rotation maybe, but stabilize that patient's head. Make sure you can feel the weight of her head so that she's not holding it up. And we're going to palpate along here. On Maria, she doesn't have super highly developed trap muscles here. So I can go in and I can actually palpate that first rib, and as long as it's comfortable for her, the angle is going to be pretty much superior to inferior within a little bit of an oblique plane right next to that thoracic segment where the rib is attaching, and thrust straight down. Basically, we're going to have to take that exercise apart because you need to stabilize the unit with one hand, practice thrusting in the horizontal plane, just like that. Do a couple of sets like that, move up through the springs if you'd like, and then simply tilt, because now the thrust is going to be more superior to inferior and right to left in this case. And it's always important to make sure that you adjust or you practice equally with both hands. Do as many sets with your left hand or your non-dominant hand as you do with your right hand or your dominant hand. In fact, I like to do extra exercises with my non-dominant hand just because it is a lesser trained set of muscle groups. We tend to perform most of our adjustments with our dominant hand, but there are certainly cases where that's simply not possible. And if you find it hard to grasp the unit this way, it's perfectly acceptable to grasp it here on the bottom to provide more stability.